always interacted with employee health because of needle sticks, for example. And back in the HIV days, people were afraid for their future, for their safety, for their life if they got an HIV needle stick. And so I always would interact with healthcare workers who would sometimes come to me and shut the door and say, okay, I'm married. Do I need to sleep in a separate bedroom? Do I need to wear a condom? Can I get pregnant? They would ask me very personal questions because employee health wouldn't always read the same studies I was reading. So I would work very collaboratively with employee health. And I had proposed at that large hospital system that possibly employee health would report to me. But at the time, they had a director who was very adamant about, no, we want to keep it separate. And so, plus, I also had a change in a boss. And so, there were a couple things leading me to leave that system to go to a system where I could be a director of employee health. It wasn't my goal in life to do it, but I understood that I had two nurse practitioners that were great in employee health. And so I would help them with the infectious disease, infection control part of their job. And they would do the new employee physicals and that stuff. So we worked very well together. And so I stayed there for almost 3 years until I got recruited to the East Coast.